Good afternoon, everyone. I welcome you all. Now the speaker is with us. We will just wait for the 5 minutes and we will start the session. If any doubts, if anything, you will be able to ask us after the session is getting over. We are will be honored and will be glad to help you with all the sorting out all the doubts, all the questions, whichever are going on in your mind. We'll just wait for the 5 minutes. Like it's almost around 2:30.
Yeah, it is 2:30.
Yeah. Just wait for the 5 minutes. Then the viewers will join and we will start the session.
Do you also understand how many have joined?
Yeah, we'll come to know.
That's later.
Later.
But not now.
Not now. No. We'll come to know that they will wave once they join. Yes, it's 2:31. We are going to start our session. I'm Dr. Aditi Kulkarni. I'm the director of Be Active Physiotherapy and Ergonomics Clinic. On the occasion of our 7th anniversary and launching a new facility, which is the exercise medicine. The facilities and the branches which are associated with this exercise medicine is one of the branch is a nutrition, which is mandatory for the patients who are suffering from the non-communicable diseases and who would like to be fit for the entire life. That's why I welcome our speaker for today's session. Dietitian Varsha Pherwani. I mean, the name itself gives a lot of things about her. There is no need of an introduction, but a few points I would like to add in her career. She is practicing dietitian since almost around 15 years across India, we can say. But the main areas where she is practicing is Aun, Baner, Balewadi and FC Road. She is expert in the field of PCOD, reversal, then metabolic disorders reversal. We in other way around in the medical terminologies we call it as metabolic disorders or the non-communicable diseases for the layman. The third is that she is into the belly fat reduction, the weight reduction, the weight gain programs, and there are n number of other things she is specialized in. But these are the basic expertise where she is famous for, we can say. Yes, I welcome you, ma'am. Thank you so much for giving your valuable time for being here. Yes, without wasting much time, I will hand over this session to her. Yes, thank you.
Yeah. Thank you, Dr. Aditi. It's a privilege rather, and I am honored to be on this this platform or this occasion of your 7th anniversary of your clinic.
Thank you so much,
and congratulations to you.
Thank you.
For the launching of the exercise medicine clinic that you have come up with.
Thank you so
much. Without wasting much time, as we have discussed that the topic is nutrition for healthy bones and muscles. So that's what I want to speak about today. What role nutrition plays, in the well-being of your bones, because there is, you have to understand that there is aging and there is degeneration.
Correct.
Okay. So what you're eating today. So your today is going to be responsible, or it will determine how your tomorrow is going to be. So the nutrition part, like what you're eating, whether you have strong bones or not, because definitely all of us know that with age there is bone loss.
Very true.
And there's muscle loss.
Correct.
So these things that you are fit today, but how is your tomorrow going to be when you're 60, 70 and 80, right? So that's what I want to, I want to give a message to the audience that if you take good care of yourself today, your tomorrow will be better. Okay. So, next is like what is happening in our lifestyle nowadays because of the lockdown and how the corporate culture is taking us. Like we are working for 8 hours, we go home and we sit for 8 hours, then we sleep for 8 hours. So are we having some time for some amount of physical activity or movement, right? So everything begins from there. Right. So everything is connected, like what you eat, but of course there has to be movement. Okay, so what I believe that if you don't control your lifestyle, then your one day, ultimately what will happen, your body is going to control your lifestyle. Okay, so you have to learn to control your lifestyle. Like you sit in front of the PC for 10 hours, 12 hours and there's no movement. Actually, I really believe that movement heals. You know, if you move, it heals, and movement is really very important. So what has happened in the pandemic and in the lockdown, people have gained a lot of weight, you know. So also because of the availability of the food, like you can just click and order Swiggy, Zomato. What is happening? People are just growing. They are growing in size. You know, some are very careful what they are eating, but some of them are just gaining weight. So what I see in my clinic is like people connect from all over and they say that in this lockdown, I have put on 5 kgs or 6 kgs or 7 kgs. Now, please help me to lose this weight. So what I'm trying to say, if at all you are gaining some weight, it's ultimately going to pressurize your joints. Okay. True. So, and you have to take care of your joints, because in the later days, if your joints are not healthy, you are going to land up with deficiencies and problems. Okay, so if at all a person loses 1 kg of body weight, what happens? 4 kgs of weight is reduced from your knees. Okay, so that's what I'm saying. Suppose you are 5 kgs or 10 kgs overweight, and if you make an effort to lose this weight, you're reducing that much weight from your knees. So you're protecting your knees, and that's what we want. So it's like, okay, weight reduction, diet, ये सब ठीक है, I am fine right now, but later on आपके joints आपको साथ देना चाहिए. So how do you go about it? Lot of sugar, if it is consumed, what happens? There's a lot of belly fat that you put on. Again, refined foods, the maida and you know, all those things will contribute to a lot of belly fat. We all know this, but the thing is, are we implementing things? Our knowledge is there, but are we making any effort to, you know, make changes in our lifestyle? Okay, so the more the weight, the more you are susceptible to osteoarthritis. That's what I want to say. So what is osteoarthritis? It is actually a degenerative disease. Okay, so how can you prevent this degenerative disease? By regular exercise and a good diet is how you can, you know, have good bone density, and you can keep osteoporosis away, especially with, you know, perimenopausal women and menopausal women. You know, we lose such a lot of calcium. You know, our hormones are not really for us in those times, and then you have to be extra careful. And calcium is the most abundant mineral in our body, and we are losing it. So what are the calcium rich foods? Most of us have the knowledge. What are the calcium rich foods? Of course, dairy. Of course, you know, cheese and nuts and greens is like the palak, methi and all those. Spirulina is a good source. Then other dairy like yogurt, and also figs nowadays are abundant. And this is a season of Sankrant. So even till seeds, olive seeds, all these are very, very rich in calcium. See, it's not like, okay, I need calcium, let me just take a supplement, you know. But then there are times when excess calcium can harm you. Right. So you have to be careful that it's better to have the natural sources. Include them as much as possible in your diet, you know. For example, let's speak about, okay, I'm having a lot of calcium rich foods. I'm making an effort at least, okay, or I'm very, very careful about my supplements, you know, whatever doctor has prescribed, I'm taking it, okay. But then how do I make sure that calcium is going to be available to my body? Or how is it that, you know, I'll be able to absorb that calcium in my bones? First and foremost, your vitamin D levels are more important. So more than how much calcium I'm taking, have you done a blood work as to what is your vitamin D level? Yeah. So it's like and nowadays you would have known that vitamin D is also so much connected to immunity, the corona and everything. So it's like, make sure that your vitamin D levels are at least around 40 or 50, you know. And if in case you have done your blood work and vitamin D levels are not optimum, you're supposed to take good supplement under medical supervision. So vitamin D is taken care of. Secondly, in case there is no weight bearing exercise, your body cannot absorb calcium. So you can talk more about exercise and weight bearing exercise, because if there is no exercise and you're going on popping pills of calcium, so I'm sure there is no absorption. What is your say? What do you say?
The same, I agree with ma'am, because when I came across many patients who are with the deficiency, because what happened in the deficiency, they immediately seek a doctor. They go to the nutrition part. They try to get the complete balanced diet. They will again try to come back their lifestyle in the on track. I agree with this, because bringing a lifestyle on the track is definitely going to help them. Definitely, their all the absorption and everything is going to be taken care of by the nutrition, the supplementations. They'll come out of that deficiency. But what about absorption in the body?
True.
You have taken 500 milligram calcium supplement, which is with a good brand also, but there is a lack of physical activity, which will still, you will come after the 6 months again in the same deficiency.
Very correct.
The same knee pain, the same heel pain. There will be the calcaneal spur. Many patients I come across because of the lack of exercises, there is a excess calcium got deposited. There are n number of things are happening. The osteophytes formation start inside your body. Sometimes it's a more of spondylosis, lysis kind of in patients. They're taking supplementations, but the still complaints remain same. Why? Is because the movement was missing, the joint mobility was missing. The third was the coordination and the proprioceptor exercises were missing, and they were just totally into the diet. So nobody can blame, not even the physical fitness trainer, not even the physiotherapists, not even the orthopedicians, and not even the nutritionists or the dietitians like that. They have taken 100% effort. The movement is missing from you. So absorption will not be there. For the absorption, you should do physical fitness exercises. There, the role of this exercise medicine or the physiotherapy fitness part comes, and that's why the way she is saying, whatever the nutrition you are eating, absolutely fine. But there has to be some kind of a movement from your body, then only that supplementations will help you.
Yeah, it could be as simple as just walk, but there has to be a discipline. Okay, I walk sometimes twice a week or thrice a week is not what we are wanting. Right. We are wanting regular exercise. At least 6 times a week, you should have a discipline of weight bearing exercise. I'm not talking about, run on a treadmill. Even if it is a walk, even if it is cycling, or even if it is, if you're lifting weights, nothing like it. Because if you lift weights, your body is going to absorb more calcium. But sometimes there is weightlifting is like women would feel weight bearing exercises jo hoti hain. What I'm trying to say, like sometimes women feel that, okay, is she saying that join a gym, and then if I do gymming and if I leave gym, then maybe I'll put on weight. No, you have to understand your body weight also is sufficient. So weight bearing exercises, push-ups, squats, all these are very, very important. Then when we are talking about absorption of calcium, if there's too much caffeine in your diet, lot of coffee, lot of alcohol, lot of smoking, these are the hindrances, you won't absorb much calcium. So nowadays we speak a lot about a Mediterranean diet pyramid. What is a Mediterranean diet pyramid? Is that the diet pyramid itself says, at the bottom, physical activity has to be the base. And then comes, your cereals, your carbs, your proteins, and your fats. So in a diet pyramid, if you look up, it's a Mediterranean diet pyramid. The Mediterranean diet is followed all across the world. Correct. Okay. And they are saying the base is physical activity. Because that physical activity is what is the missing component, because the life has become so demanding that people hardly have any time. So time for workout, but discipline is important. And coming to proteins, we spoke about calcium. Now muscle health, muscle loss. As we age, we have muscle loss. How should we take care that, we are preserving the precious muscle in our body? Now muscle is made of protein, and protein comes from what? There are 2 sources of protein. The first source of protein is the first class protein source, which is chicken, egg, fish, and paneer and whey protein. This is first class protein, the non-veg protein. Okay. The second source is the second class source of protein, which is all our dals, all our pulses, the vegetarian sources, okay? Because some of the amino acids are lacking in the vegetarian protein. So right now, consider a normal adult requires a moderate protein of 50 to 60 grams per day. And you consider what you're eating throughout the day. If you are an eggetarian and if you're not eating even one egg in a day, you are not getting sufficient protein, because egg is very rich in protein. It's the best source of protein. It has a good amount of vitamin D, B12. The egg yolk especially is healthy. Now it depends. If you have higher cholesterol, then you should keep a ratio of how much of yellow you are eating and how much you are throwing away. But I would suggest, if you're eating just one egg in a day or two eggs in a day, please do not throw away the yellow, because it's a very rich source of other nutrients also. So what I want to say here is, like, Indian diet is sometimes so very poor in proteins. If you're having, I always say, if you're having a nashta of poha upma and you're having a lunch of bindi chapati and your dinner is a little bit of dal chawal or khichdi, so Aditi, where is the protein in this? It's like the protein is lacking. And you're losing muscle mass. For growth you need, for nails you need protein.
Correct.
Your skin, your hair, everything is made of protein.
Block of your body.
Exactly.
I can say.
Exactly.
The basic is
So
building block.
yeah, but I'm not insisting here that you have high protein diet or take 2 scoops of whey protein. I'm not saying that. What am I saying right now is, like, if you have 3 meals in a day, at least make sure some protein sources coming in, with discipline. Like if not eggs, at least the green moong or at least the paneer, add some protein to your diet. All meals, add some protein, so that will take care of your muscles, and also don't be scared of healthy fats. What I mean by healthy fat is the olive oil, cheese, ghee, butter, they are also required for lubrication and all this.
Synovial fluid, which is
exactly
actually the joints which are going to get a lubrication from, is the synovial fluid.
Yeah.
And definitely the healthy fat, which is not going to get converted into the high cholesterol, which are going to get absorbed in your body, which are going to be beneficial for your body, which I always suggest to my patients also, like, this is something which you're lacking. Your reports, the blood reports are saying that healthy fat is missing. So there where you're lacking, so these healthy fats are necessary in your diet.
So the omega-3s, like if we speak about, say, almonds and walnuts, if we speak about flaxseed,
Correct.
We are taking it, but then it has to be taken with discipline. And if consistency is there, then you will get the goodness out of it. So that's how it is. So I want to bring one thing to the notice of audiences. Like, there is something known as, if you ingest higher amounts of calcium in the form of supplements, that could be harmful. It is known that extra calcium could harm our heart also, and it could cause certain cancers.
Well.
So it could cause certain cancers. So you just go to a pharmacy and across the table you ask for a calcium supplement, and you're not even sure that what you're taking, what is the actual requirement, just because everybody's taking, so I am taking. Correct. So don't do that, because excess of all this is not good.
Have to have your blood reports in your hand.
That's true.
Am I deficient?
That's true.
Is it actually necessary for my body or not? Unless and until there is a deficiency below 4 or 6 or any kind of a thing, then definitely depends on your physical fitness activity. The dietitian will allow you to take this much amount which is actually required for your body. So like the healthy person like me who don't have any aches and pains or any kind of other thing, if I directly go and ask for the calcium supplementations, I'll take it for the 3 months or the 4 months, it is going to harm me.
That is true.
For sure it is not going to benefit me.
Even kidney stones, sorry to interrupt you, even kidney stones.
So yeah. Definitely, because excess calcium is getting deposited in my body, which was not my requirement.
True.
And I'm giving it to my body without even its consent. Because my body said I am enough. I'm having enough of calcium, I'm having enough of hemogram, I'm having enough of omega, I'm having enough of glucosamine, but I have not checked only my reports. That's why yearly reports along with the fitness,
very important,
along with the nutritional guidelines from the nutritionist is utmost on priority.
So when you come to a clinic like mine, so when you stand on the machine, so we check your fat percentage, your visceral fat, and we check your BMI, and we do the entire body composition analysis, and then we we make a personalized diet plan for you. Okay, you have less of muscle mass, so probably you're eating lesser proteins. Now if I say, okay, you eat more proteins, but sometimes what happens, for some people extra protein can cause acidity, and extra protein in some people they are higher in uric acid, and then we can't just tell them, okay, have a high protein diet. So the entire parameters, your blood work has to be done. Sometimes people, I ask my clients, okay, they have come for belly fat reduction, but they just got a blood test done, and we come to know that their vitamin D levels are hardly 10 and 8. So it's so low. And then because how do you get vitamin D is like, there is not so much vitamin D in our food. So, and for you to get sufficient vitamin D, you need to be a farmer working in the sun for 3 hours, which none of us will do. So that much absorption of vitamin D would not happen. So it's better if you're deficient, you take a supplement of vitamin D. It's like, I guess it's like 1 tablet for 8 weeks, and then you're fine.
Yes,
The 6
once a week or thrice a week.
or a sachet.
And then it is up to once in a month, and then 6 months in a month.
True.
So this is the way you have to reduce the supplementations also. I'm taking everyday vitamin D.
No, that's wrong.
That's wrong. It is completely wrong.
Yeah.
Never do that, because it has to be the tapering way. The second most important is that immediately every after 6 months you are going to keep a check on your vitamin level and the vitamin D level, because this is one of the vitamin, whenever you start taking supplementations, immediately show the result.
That's right.
Immediately.
Yeah.
You will come across my ranges are now quite okay, but am I getting absorption in the body? So where you can be lacking in your physical
fitness.
So those are the parts which you also have to take care, and you have to be in touch with the nutritionist to where I'm lacking with my food, or am I lacking with my physical fitness.
See, what happens, there's always a need, Aditi, I feel, for an expert to guide you, because say Google has such a lot of knowledge, but then is this working for me? Is this tailor-made for me? Like, for example, you need an expert doctor who will give you the prescription for whatever problem you have. So you need an expert physiotherapist who is going to tell you, okay, because of this pain, you do this exercise. Correct. You benefit more when you go to the expert. So for nutrition also, that's so important, because as I said, how you will be at the age of 80 and 70 will depend on what you're eating today. So then it's important to go to an expert, and I always say that you must invest in yourself, invest in your health. We do so much for our homes and our cars and everything, we spend such a lot. But when it comes to my health, okay, then I do so much for my career, and I'm like giving so many hours of my day for my work. So why not for my health? Why wait till it is too late? So it's better to connect with an expert, because if you have pre-diabetes, it can be reversed. If you have higher triglycerides, it can be reversed. And you sometimes if you have lesser calcium, you are weak in your muscles, your body will give you signals. Okay, something is wrong with me. Some weakness is there.
The feeling of illness is never going to be go off.
Yeah.
You will always be into some sort of a lethargy, or you will keep complaining, I am not well. Yeah. So what is not well? It's about your nutritional deficiencies, which you have to cope up with.
It's like, let food be your medicine. Correct. Rather than depending on supplements and all the time, this vitamin, that vitamin, you're just popping pills, multivitamin and all that. But then if you can get the goodness from real food, like especially avocados are very rich in healthy fat, but sometimes you might say avocados are not plenty in India, or we don't find them often. Okay, but a lot of salads and everything, which you can just sprinkle a little bit of olive oil, that will also give you healthy fats. And the till seeds that I'm saying, not necessary you have to mix it with sugar and make something sweet. You put a lot of roasted till seeds into your salad as a topping, and it turns out to be so good.
Right. Eaten any kind of a burger.
Exactly. And
this is a very simple way of using, just season with olive oil or season with any kind of till. It's also going to be make sure that your nutritional requirements are full.
And what I want to say is, like, an vegetarian can be told, okay, eat eggs daily. All right. But then what about the vegetarians? If I say to them that eat paneer daily, will they eat? I'm not sure, because people feel if I eat paneer, I'll become fat. Yeah. So
I
that's
was also having this concern.
But then how are you? What the first class protein that I spoke about, for vegetarians, the first class protein source is either whey or paneer. And 100 gram of paneer made out of skim milk or something should not be a problem. So we have to focus on.
Yes, there are 2 marks on the paneer which I realized when I went to any grocery shop. There are 2 things are there. One is a red mark and one is a green mark. So go for the green mark. I am also eating. I am not becoming fat at all.
So
Yes,
also.
of course I am fat.
So no, but I have, believe me, I have clients coming to my clinic who are in 10th standard or who are just, passed out, and they are still above 100 kgs.
Yes.
So this is the result of the lifestyle that we have, because the fast food is so much available, Coke is so much there, fries are so much there, and emotional eating is so much there, and you were kept away from your friends in the lockdown, and what you had was food was the only comfort you had, and that's how children have gained weight. Not only children, even adults have gained weight, because where is the physical activity? It is lacking. Either we don't have the motivation for a physical activity, or then we have other good things to do. So it's like that. So unless that discipline is there, because what happens, your association matters is like if you're connected to an expert. When your motivation is low, the expert will give you the motivation to go on, and this is how things can be added. And it's not like this is a diet for me today and this is going to be the diet for me all my life. No, you have to keep changing as per your blood work and everything, physical activity also.
Like my patients have always given me a feedback. She was always available on the WhatsApp.
Yes. Yeah.
So the communication with the experts on a daily basis or on weekly basis or the monthly basis, which is what we expect. Because when they are guiding us, automatically it will be the result 100%.
Yeah, that's
because
true.
Because if something going wrong, they are there to correct us.
So I tell my clients that the more you're connected to me, the more you're going to see the results. Yeah. So the more you're connected to the physiotherapist, also the more you're going to see the results. So it's like that.
Make sure they reduce it for sure.
Yeah. So it's like that. So that's how it works. And it's not like, okay, I lost 1 or 2 kgs here and there. Not like that. It's important for you to know what is my ideal body weight. And for how do I maintain near my ideal body weight? Okay, if I've been plump from childhood, but at least that's not the thing that I'll keep on remaining plump. I have to come to a set point that this is my body weight which I will maintain. Believe me, it's not difficult to lose 3 kgs of weight in a month if you follow a proper diet, no starvation, eating healthy. Because this one very important thing I want to convey, whether it is counting of calories that matters for weight loss, or whether it is controlling of the fat storing hormones that matters. So there are different ways how an expert works. So I never make my clients count their calories. I always control their fat storing hormones, and that's how their body gets into fat burn.
Definitely.
So that's a better way.
And because the fat storing hormones are more inside your body, the food which is rich source of vitamins, proteins, automatically the happiness hormone secretion is going to be more.
Correct.
So the endorphins, the serotonin, we don't have to work extra on that.
Right.
It is always going to be
there.
on your body,
yes.
And you will show on your face, yes, I am happy. Whatever the food I am eating, I am very happy with that food.
Yes. So when you get to eat good food, you feel happy. Food is like happiness for all of us. It's joy. We celebrate with food. So it's not like going to a dietitian is going to be punishing or I'll be like, she won't give me to eat or anything like that. It's not like that. So whatever age you are, my message to you is like, you need healthy bones, you need healthy muscles, you need to protect your joints, and you need to make sure that your joints are not bearing more weight than they should. Take an example of a mixer grinder in the kitchen. If it has a capacity of half kg of grinding and you're putting 4 kgs of masala into it for grinding, it's going to give way. So is your body. It's made for some particular amount of weight that it can carry. Don't overload your body, and be kind to the organs also. Yeah, to the organs also.
Be like day before yesterday, there was a session, love yourself first. So say I love you, I like you, I respect you, that kind of words the speaker has used. So this is how exactly you can love yourself.
True.
Like give the proper nutritious food. Definitely you eat 6 times also. We do not mind about it, but definitely do not provide with the fat and the extra supplementations.
Yeah.
There are natural resources available, so focus on those.
Very
Yes.
correct. Very correct. So I hope
it
we
is.
have cleared quite a few,
Almost, yes,
covered most of the things now.
So yes,
And,
definitely.
yeah.
Almost everything. So this is definitely is there. And why the muscle, bone, everything is associated with the nutrition. That is the reason I have chosen this topic for the health talks. Because once the patient are into the physical fitness, I have seen the simple step up test also they are not able to pass with the corrected way. Because excess fat is making them tired. The second one is their cholesterol. The third one is their lack of nutritional balance because their muscles are getting fatigued too often. The fourth is the calcium supplementations because already the wear and tear, the aging is so fast, they are not able to cope up with the fitness test which I am taking with the flexibility point of view. And as soon as the report is in my hand, it is too up and down. So it's a demoralizing for them. So best solution is to go for the fitness expert, the nutritionist, the dietitianist. Take your entire body's assessment, as if definitely we are going to give you the assessment report for the entire body system. But where exactly you stand in the contents of your body, which is required for the fitness point of view. Those are the people who will be able to explain you, who will be able to correct you, whatever may be the fat you want to reduce. Like one word I have used it previously. She is expert in reducing the belly fat. How we are going to focus? They know it. Then the PCOD which I was talking about, that time in the PCOD people get this kind of a muscle bulk very often, and in the gymming instructors keep complaining, Aditi, they are not reducing. What we can do? The muscle tone is there, they are doing the weights, everything is there, but every now and then the phone calls for that, they are not reducing it. So what to do? So those part will be taken care by the nutritionist. Because you are in PCOD, how your hormones will support you and the weight training and everything will help you to reduce your weight.
Very correct.
It's not going to happen.
Very correct.
So it's important that this is a time to seek the nutritionist. And I always suggest simply a healthy person visiting a nutritionist, no harm. If you have crossed the age of 30, it is utmost on priority. You should seek a nutritionist help. What is good for me and what is bad for me to prevent extra fast aging is also mandatory.
Yes.
Because what you eat is going to come out.
Yes.
And if you don't have anything, for sure you will later on have it. So avoid doing that. Make sure it's the right time to make yourself completely healthy. At whatever may be the age, at whatever may be the point you are in right now, it's seek experts, they are ready to help you.
So they say no, prevention is better than cure.
Yeah. Always.
Yeah. So prevention is what we are looking at because you would have seen elderly people around you and you would have seen the amount of medicines they have to pop in, breakfast, lunch and dinner. If diabetes comes in, if hypertension comes in. So not necessary that it's going to come to you also, because if you're careful, it might not come to you. If you're careful, it might not come to you.
It's not always that generation to generation have to be in the diabetes.
Yeah.
My father had, I had. My father had PP, I had.
Not necessary.
Not necessary at all.
It can be reversed. It can be, even if there is pre-diabetes, it can be reversed. Yeah.
Definitely. There are chances that you are not going to be into this. So the physical fitness along with the proper nutritional guidelines are at most on priority. She is expert into this. Definitely she will do your assessments and she will be able to guide you in the future. This is the end of our session. If any questions or anything you would like to ask, now you can write down on the this comment box. We are ready to answer you all the questions. Thank you so much for being being a wonderful audience and being so patient. Thank you so much.
Yeah.
I'll just check if there is any question. Is there any question? If any questions or anything, you can write down in the comment box after the after the finishing this session. I'm posting this video on the IGTV, so you can share it more. Do like, and if any your feedback is valuable to us.
Definitely.
Thank you so much.
Thank you.